Right, Max Morning, Max Morning. Welcome to another wonderful time. It's good to have us all tonight. Yes, Max Morning. Let's have a quick roll call wherever you're connecting from. Please, let's get to the chat room. Wow, it's awesome to see everyone ready. We're ready to be fired up today. Max Morning. So let's get to know where you're connecting from, your name, your location. Max Morning, everyone. Okay, good. It's good to have Haja Rafat from Ilorin. I can see in the chat we have lineup of other people ready to learn today. Wow, awesome. And very interesting, we have our able doctor set for us. He's a very busy gentleman. He loves to be called a gentleman, and he's a very busy gentleman, someone who really have passion in saving life with all humility. I would like to recognize in a short notice wonderful gentleman, Dr. David Etukessien. You'll get to know more about him in a short while. In a minute from now, he will take over the floor. We met online. We got to talk about this opportunity online, and he said yes to this business even when I had no experience. That's the amazing thing. I had no experience about Max International, but Dr. David said yes. And it's been a wonderful journey. I really respect you so much. Let me just say something. I think I've said it once before now. The day I respected Dr. David more, that was 2020. I was in Akwa Ibom State. We had dinner together, went to bed. And in the morning, we usually have routine prayers together. 6 o'clock, I still dragged myself out of bed, only for me to discover that 3 a.m. he went to do surgery for a patient in his hospital and came back to the house and was awake before 6 a.m. for prayers, man. Honestly, that day I just said, Emmanuel, I think you are still playing when you see leaders like this. So it's been wonderful having someone who is a chief medical director uh, in Max International, and he's had over 36 or 37 years on his fingertips practicing. I mean, I can't say so much, but I would like to give the floor over to you, sir. Dr. David, you are free to unmute yourself, sir. Go ahead. All right, so the next voice you will be hearing will be that of Dr. David Etukessien. Unmute yourself, Dr. David. Okay, go ahead.
Good evening, ladies and gentlemen. Next morning, it's been a wonderful time this evening. I want to pay respects to whom respect is due. And for this night, respect is due to my immediate boss, my friend, the one who introduced me to the Max business, Mr. Robinson Emmanuel. I want to thank you so much for charting the path, for making this business a reality for me. I remember when you invited me, I didn't know my left from my right, but I had that trust and confidence in you, and I decided to go with you. So far, no regrets. There will be no regrets, whatever happens. So I thank you so much for this inviting me this evening to this interview meeting. Thank you for now.
Thank you so much, Doctor. So in case we have anyone with question, please let's drop our question. If you have any question, if we have anybody with question, today promises to be health, want to give helpline, what we need to know about our breakthrough science. It's not the regular conventional presentation slide. want to give you solutions that you can take to your customers. So the floor is yours, Dr. David. So once we have any question in the chat room, let's keep dropping our questions right away. So do we have questions from anyone? Existing associates, you are free to ask questions, okay? As existing associates, we can ask questions to help us to grow. Now, if some of us would like to type, please, if you can hear me very well and you can hear Dr. David, give 2Y, like yes, yes. You can hear me and you can hear Dr. David very well. Please give us 2Y, like yes, yes. Oh, thank you very much. Oh, all right, good. Thank you, Mr. Saeed Shanusi. It's good to have you. It's good to have Haji Rafat. It's good to have a lot of us. So let's drop our question. Oh, Chris, I bet there. Oh, thank you very much, Emeka Val. Thank you very much, Robinson Joseph. All right, so let's drop our questions. It could be on any health issue. We have an authority that will help us to understand more right away. All right, so we're waiting. Okay, let me drop a question I got today. In actual fact, in few minutes, okay, yes, okay, thank you. We can see that people are coming up with that response. You are hearing us. Someone said, please, what will be the cause of someone that lost the sense of taste and to perceive any smell? Okay, so my question, okay, already we have Haji Arafat with a question. Please, let's keep bringing our questions. Doctor is here to attend to us. So my question is, what could be the cause of someone that lost sense of taste and the ability to perceive smell? And if there's any solution, you can go ahead and tell us, doctor. So once you're done with that, I'll drop the next question, sir.
I suppose I have the floor.
Yeah, sure, the floor is yours.
Okay. The sense of taste, as we all know, originates from the brain. The brain is about the most important organ in the body. Every sensory organs take their bearing from the brain through connections through the nerves that connect through the brain. Taste normally is a perception you feel in your mouth. When you drink or you eat food, you feel a taste on your mouth because there are taste buds located somewhere in the buccal cavity. The mouth is called the buccal cavity. And there is a connection through nerves, connection from those sensory buds, taste buds, to the brain, which interprets what you put in your mouth. If you put something that is bitter, there's a portion of the brain that interprets what you taste as bitter. If it is sweet, there's also something, a portion of the brain connected by the nerves that gives the interpretation of sweetness. But once in a while, you lose the taste of taste. You lose the sense of taste. I'm sorry. It happens most often. The commonest reason these days is if you have malaria or you have typhoid. Discover that food does not taste. You don't have appetite. Even when you put the food in your mouth, it does not taste well. So that is the commonest cause of loss of taste. But these days, there have been exaggerated responses to loss of taste. One of the most common trending conditions now is the COVID-19. So if you go to a medical practice now, you go to a hospital now and tell the doctor or the nurse that you've lost your sense of taste, what will be behind the reasoning of the medical personnel today is COVID-19. But be that as it may, it's important that medical personnel should always remember that the primary cause of the loss of test is the common things, typhoid, malaria. But these days, if you report it in a hospital, certainly they will ask you to run a COVID test because COVID-19, one of the symptoms of COVID-19 is loss of smell and loss of taste. Thank you for listening.
Oh, thank you very much. That's very, very straight and direct information. Okay, now Haji Rafat from Ilorin is asking, can someone with low sugar use longevity? Someone with a low sugar condition, can the person use longevity?
Okay, low sugar is a condition that is not very common, but it has been recorded. There are some patients who come who present in practice with low sugar. Sure, certainly. Longevity is good for those with low sugar and also for those with high sugar. It is used. We see the mechanism of action of longevity is why you need to know that you can use it in low sugar and high sugar. What does it do? All of us know longevity stimulates the production of glutathione, and we all know as associates what glutathione does to the body. So longevity is recommended for patients complaining of low sugar. But in addition to that, I must warn here that you must work in close conjunction with your doctor. You must work in close conjunction with your doctor when you're treating both low sugar and high sugar. Because low sugar is very dangerous. If you deprive the brain of sugar, that is glucose, the brain can become dead in minutes. So low sugar is more dangerous than high sugar, which we call diabetes. So it is a medical emergency. People with low sugar must work in close conjunction with their medical practitioner. It's not something you stay in your house and drink glucose or drink carbonated drinks, all with the hope of shoring up the sugar. You must work in close conjunction with your medical practitioner in addition to taking your longevity.
Wow, thank you. Thank you so much for that. That's so solid and so profound. Now we have a question from Mr. Saeed Shanusi. He's an amazing leader
Okay.
in Lagos, a powerful network marketer. He said, how would you advise someone with diabetes for over 10 years with a lot of tissue damage with the use of longevity? So how can we advise someone that has had tissue damage, with 10 years history of diabetes and with a longevity breakthrough solution? Please go ahead, sir.
Well, diabetes, we all know, is a condition where your body cannot metabolize carbohydrates. That is, your body cannot use sugar or glucose, even though you have it in abundance. But the cells of your body cannot utilize the sugar that is so evidently abundant in your body. Therefore, this sugar spills into the blood and into the cells and becomes high and dangerous. Once the sugar is high to a certain level, the sugar is deposited in the cells. But if I may ask, why is the sugar high? Why can't the body utilize sugar, knowing so well that sugar is so much abundant in the body? The absence of insulin is primarily the cause of high sugar levels in the body, in the blood. If there is low insulin, or if your pancreas is not capable of producing insulin, then the sugar will accumulate in the blood. And once it accumulates in the blood, it will spill over into the cells. And once it reaches the cells, it causes tissue damage. If it is in the, for instance, it can affect the nerves, and cause what we call neuropathy. Neuropathy simply means damage to the nerves and inability of the nerves to function. If it is in the brain, of course, it can cause severe brain damage leading to loss of consciousness, depending on the level of the sugar. Sugar may be so high that the patient enters what we call a diabetic coma. These are all emergencies. So let's go back to your question now. How would you advise someone with diabetes for about 10 years with a lot of tissue damage with the use of Celgivity? Good. What Celgivity simply does is to allow the body to utilize insulin. It increases the sensitivity of the cells to insulin. It also allows the pancreas to produce insulin to meet the body's requirements. So if you take Celgivity, it produces glutathione, and glutathione has been known to assist the body in the production of insulin. It also sensitizes the cells of the body to the effects of insulin. Maybe you may have been able to produce a little insulin. What glutathione does, what Celgivity glutathione does, is to increase the sensitivity of those cells so that those cells are able to absorb the sugar. It also allows the pancreas to produce adequate insulin. It enhances the production of insulin by the pancreas. So if somebody has diabetes for about 10 years, it's possible that there is extensive tissue damage. There may be kidney damage. There may be brain damage. There may be damage to the eyes, the retina of the eyes. So what surgery will do for you in combination with your routine drugs by your medical practitioner is to reduce the tissue damage and allow the cells of the body to recover itself. It produces glutathione, which is utilized by the cells, whatever cells of the body, the brain cells, the nerve cells, the cells of the whatever organ that was affected. The injection of Celgivity will produce glutathione, which will now be utilized, and that will reduce nerve damage, tissue damage, brain damage, kidney damage, and also gives the body the ability to recover on its own. Thank you.
Wow, thank you so much. I think you said something very, very, very striking, and
Okay.
so many people may not know. I'm just getting a second-hand, second authority on that statement of people going on diabetes coma, something like that. Yeah, I've had a very close case of that. All right, so the next question is from Madam Mary Gadzama. She's a health worker from Maiduguri
Okay.
Hospital, and she's a powerful associate working towards bronze. She joined a couple of weeks ago. Now, her question is, can someone who is diagnosed with early signs of breast cancer be okay after taking Celgevity and Max 1 for 3 months duration? So can someone who is diagnosed with early signs of breast cancer be okay after taking Celgevity and Max 1 for 3 months duration? Please go ahead, sir.
Yes. Thank you, Mary Gazama, for this question. I would like us to underline that word: early signs of breast cancer. Early signs of breast cancer. That is very important because most patients in this climb report late with breast cancer. When they report late, slightly may have been spread. The cancer cells may have spread from one breast to the other, may have spread from the breast to the tissues, may have spread from the breast to the chest wall, to the heart, to the lungs, the kidneys, the major organs of the body. That is when they report late. But if you are able to pick up breast cancer early, just when it's about starting or just when it has started, then there is good remedy. The prognosis is very good. In that case, the combination of Celgivity and Max 1 for quite some duration, maybe 3 months or even more. I advise my patients when I see them early to take it for some time, maybe about 6 months, then they come back for review. But cancer is something you cannot treat on your own. Breast cancer is something that you must go to a hospital. You either see a surgeon or you see a gynecologist. You know, the breast is an area of struggle. The gynecologists they have the right to treat patients with breast problems. The surgeons also lay claim to the breast. So it depends on who you want to see. Actually, the management has been divided between the two of them, between the two specialists. So if there is an early sign of breast cancer, it is pertinent that you see your doctor, is either a surgeon or a gynecologist or both of them, and they will marshal out your modalities for treatment. Most of it, you may not even require chemotherapy uh, or radiotherapy when it is early. But it is proven that if you take Celgivity and Max1 at that stage, there is a lot of remedy. It can help reduce the onset of severity of breast cancer. But again, the duration, I wouldn't say 3 months. I would say take it at least for 6 months, then go back for a review. Either you do a mammogram or you do a scan if you have an expert who is good in scan. But I think the gold standard is a mammogram. Thank you.
Thank you very much, Doctor, for that. And I think this is a very fantastic message to all our women, having an
Yes.
early complaint makes it easier and better. All right, we have the next question from Mr. Said Shanusi. Can someone with chronic ulcer use longevity and how can it be administered?
Thank you so much, Mr. Sahid Sanusi. An ulcer that is chronic is a long-standing injury, uh, very common on the leg. I believe you're talking about a chronic ulcer, not peptic ulcer, something like an ulcer wound on the leg. If that is the case, chronic ulcer is amenable to glutathione enhancement. Again, I would like to sound a note of warning that chronic ulcer has a predilection for becoming malignant, that it can become cancerous. Therefore, management of chronic ulcer must be done by a medical practitioner who has experience in that area, who will wish to assess the ulcer, do some histological evaluation, and ensure that there is no tendency to cancer transformation. That being the case, Celgivity again, because of its mechanism of action, what it does, if I may repeat myself, Celgivity releases glutathione into your cells, into the system. And when these systems imbibe glutathione, they regenerate the cells, regenerate healing. That ulcer that you had, the healing will now be accelerated. And whatever medications you were using to treat that ulcer will become even more effective. Remember, when you have an ulcer, ulcer means there's a wound there, a chronic wound. There are several modalities for management. One of them is dressing, wound dressing. Initially, maybe about 2 or 3 times in a day at the initial stage. Later on, depending on the success achieved, you may wish to reduce it to once or twice a day, or then once every other day. But while that is going on, the doctor must have done some culture and sensitivity on the wound, chosen an appropriate antibiotics. Then you may wish to add your Celgivity. There's no contraindication. Celgivity goes along very well with whatever antibiotics you are giving. So what you asked, how can it be administered? Normally, use it a normal dosage. two in the morning and two in the evening. Thank you.
Thank you very much, wonderful doctor. Thank you. That's an amazing one. I think I'm getting to understand more. So sometimes some people think ulcer is just the ulcer, stomach ulcer you have internally. It could also be extended to a long-standing wound. So, and I think we are getting the medical advice right now. So another question from Hajia Rafat Yisha Wishaku. She's an amazing, powerful woman. Very busy executive, but Max International is next on her fingertips. Now she's asking a question: at what stage can longevity work for fibroids? And can one add another product of Max for the treatment? At what stage can longevity work for fibroids? Go ahead, boss.
Yes, thank you, Aja. Thank you. Nice having you at this meeting once again. Well, again, if you meet fibroids at an early stage, it is amenable to several forms of treatment. But where the fibroids are huge and are located at a particular place, management will depend on the size of the fibroid and their location. For instance, if there's a lady who has fibroid and is looking for a baby, and he has a fibroid located within her womb, inside the womb, not outside the womb, then that fibroid has to be taken out surgically. But if the fibroid is of a small size, whether they are multiple or not, of small, when I say small size, I'm talking about between 2 to 4 cm. It's considered small when you talk about fibroids. When they are that small, I have patients have placed on Celgivity and Max 357, and we have observed remission of the fibroids. Like instead of increasing in size, they've been able to, stagnate the growth and subsequently start reducing in size. Remember, again, I said it depends on the size of the fibroid. If the fibroid is huge and is causing complications, no matter the location, it has to be taken out surgically. Again, if you have a fibroid in a woman who is no longer of childbearing age, please underline that word, childbearing age, woman that is no longer menstruating, whatever the location, provided that fibroid is not causing secondary symptoms, is not causing complications, you may wish to ignore that fibroid, because once the woman starts menopause and the level of hormones, the female sex hormones, drops, the fibroid is bound to shrink alongside. So we are never in a hurry to remove fibroids for women who have hit the menopausal age. And indeed, for such women, Celgivity and Max 357 will work like magic. Thank you.
Wow, that's awesome. Thank you. Thank you so much. Thank you so much. I hope we're all getting value. Please, if you are getting value from this Q&A session with our wonderful doctor, Dr. David Etukessien, please help me type in the chat. I'm getting value. If you're getting value from this meeting, let us know. All right. Quick one. I would like a doctor maybe for one or two.
Hello. Okay. Not hearing again. Yeah, I'm getting value. Hello.
Hello. Oh, sorry. Okay.
Hello.
Can you
Yeah,
hear me,
I
please?
can hear you now.
Oh, sorry, my mic was on mute. Okay, so
Okay.
we are getting value. Thank you very much. It's good to have amazing man, Mr. Olusheye Shobanjo. He's one of the lecturers in Max International Lagos, the headquarters in Nigeria. He's one of the leaders that trained me, and we're still learning. All right, so thank you, Madam Mary from Maiduguri. You're getting value. Everybody, we're getting value. So Eunice, please drop your questions. We have a few minutes so that we can allow our doctor to go. While the question coming, let me just say something. I know Dr. David is a very, very humble gentleman. I mean, this is someone who is so busy. He consults for governors, for top government officials, and he works as busy as the clock, but I'm so happy and super proud, of his impacts in the business. All right, and let's have more questions. Now, Doctor, please, can you help us tell us the uniqueness of Max 357? Max 357, what's the uniqueness of Max 357
Yes.
over other products so that we get to know? Thank you, sir.
Max 357 shares the common property with all Max products. And what is that? It contains glutathione. It generates glutathione. That is one key feature that we have that is common for all Max products. But in addition to that, 357 contains essential fatty acids. There are three of them: essential fatty acid 3, essential fatty acid 5, and essential fatty acid 7. In the past, we used to have fatty acid 3 alone, but thanks to Max International, they've been able to add 5 and 7. And what do they do to the body? They regulate the circulatory system. By circulatory system, I'm referring to the heart, I'm referring to the lungs, I'm referring to the nerves, blood vessels, and nerves. So if you take Max 357, its main uh, side of action is in the cardiovascular system. It goes to your heart, it regulates the functions of your heart in conjunction with the glutathione, which it also contains. It also goes to your tissues and eliminates the bad cholesterol. It eliminates the bad cholesterol from your system, and also imputes the good cholesterol. Cholesterol is good, cholesterol is also bad. What we call HDL is the good cholesterol. The LDL is the bad cholesterol, which is very common. Max 357 increases the production of HDL cholesterol, which is very good for the heart, very good for the cardiovascular system, that is the heart and the blood vessel, and the nerves in particular. So that is why we recommend 357 in conjunction with Celgivity. That combination is a bombshell for whatever conditions that you have.
Thank
Thank
you, sir.
you.
All right. If I'm not mistaken, I think HDL is high density lipoprotein and LDL is
Yes, high density lipoprotein,
low density.
low density
Wow, thank you. Yes, actually,
lipoproteins.
I need.
You are too much, Mr. Robinson.
All right, we have a question from Francis Eunice in Port Harcourt, an amazing leader that is pushing and going to make it to the top. He said, sir, a client used Metal Switch, which is a weight loss product, and said he
Formula.
started having
Yes.
chest pain and stopped taking it. What do you suggest, sir? Do you understand the question? Someone used a Metal Switch that is for weight loss and started having chest pain and he stopped.
For that question, hello? Can I continue?
Go ahead, sir. Yes.
Yes. Metal switch, we all know, contains glutathione, among other things. And what does it do? It allows the patient to lose, or the patient to increasing the heart rate. That is why it is unique and different from all other weight loss formulas that are available. When you take these other drugs, it will lead to increase in heart rate. And when your heart rate increases, it will increase your blood pressure. And that is a source of concern for anybody taking it. But max meta switch will reduce your fat without a corresponding increase in your heart rate. So let's look at the question now. You started having chest pain and stopped taking it. What do you suggest? Well, I would like that person to look out for other causes of chest pain that may have been present in the person's system. There may have been other reasons for the chest pain other than the meta switch. We've not known meta switch to cause chest pain. Chest pain is not a recognized side effect of meta switch. So what I'll suggest is I'll ask that client to see a doctor, let them examine her thoroughly. If possible, they should do echo test for her, should do an echo test for him or her, and look for other causes of chest pain. It may not be the max meta switch, but on the whole, I'll suggest the person should discontinue the max meta switch, seek medical attention first before any other thing. Thank you.
Thank you very much. Thank you very much, wonderful doctor. All right. I wish we can have more questions. More questions. Let's drop our questions. If you have questions you like to drop now, quick in-house information. In case we get knocked out, you can relog in with the meeting ID and the passcode.
Okay.
I promise us latest by 9 p.m., just in about 20 more minutes, we'll be done so that we can retire to our bed and plan for tomorrow. We don't want to also stretch our doctor that have been up and doing for hours. So in case we get knocked out. Now, sir, can you help educate people between high blood pressure and low blood pressure? Because it looks like a lot of
Okay.
people ask question more about hypertension cases,
Confuse
hypertension
the two.
cases.
Okay.
Can you help us, sir, with
All right. Yes.
hypertension?
Well, when you say high blood pressure, that is hypertension. It's the opposite of low blood pressure. There's nothing like low hypertension, but hypotension. It simply means the tension, high blood pressures, which is hypertension, simply means the tension in the blood, in the arteries, in the blood vessels that take blood from the heart to the periphery. When I say periphery, I mean other parts of the body other than the heart. The pressure in the blood vessels that take blood from the heart to the periphery. If the pipe, if the water is much and the pipe is narrow, so there will be tension in that pipe. The same thing happens to the human body. If your blood pressure is high, it means the tension of blood as the blood passes through the vessels is turbulent. There's no tension. But again, I wish to warn that low blood pressure is also a medical emergency, as equally as dangerous as high blood pressure. In high blood pressure, the BP is above the normal, above 140/90 millimeters of mercury. Some patients may record levels as high as 180/120. When that happens, you are said to have severe hypertension. But for hypotension, the levels can be very, very low. I have seen patients who record levels of 60/40 millimeters of mercury. When that happens, of course, the patient may not be able to stand erect, may not be able to function, will become dizzy and weak, and it's still also a medical emergency. Both conditions require treatment. Both conditions require treatment. Both